In this presentation, we're going to be talking about visions and vision and optics and what myopia and hyperopia are. So, understanding that lenses bend light. When light shines through any refractive surface, it bends, whether it's a piece of glass or a magnifying glass. And the eye's the same. When the image enters the eye, the eye will bend the light in some ways. There are two main types of lenses: concave, which is minus powered, and convex, which is a plus powered lens. A plus-powered lens will add power to a system. So if light is entering and it hits that lens will then bend the light to come into a singular focus point. A minus-powered lens actually takes power away. So as the power comes in, it then spreads the light out further. That's why if you take a pair of glasses and they're minus-powered, as you look at them, an object will appear smaller. Whereas if you take a plus-powered lens, the object will appear larger. When light bends through a lens, you can bring the lens either closer or further to focus the light, just like a magnifying glass. And because focus relies on the distance from the lens to the paper and the power of the lens. So really we're dealing with the total power of the surface or the lens and the distance. Those two things affect the total effect of the system. The eye is the same way. The power of the eye is made up of the front surface, the lens of the eye, as well as the cornea, and the length of the eyeball. How long is the eyeball? The eye has two power points. Number one, cornea, and number two, the lens. We learned that the eye starts at about 16 millimeters, and that means that the perfect eye starts with a total power of 60 diopters. 2/3 of this comes from the cornea, and 1/3 of this comes from the lens. That's why when we use some of our instruments in the back, which measure the shape of the eye, most eyes are around 45 diopters in their curvature. So that means that the cornea is 45. That means that the total power of the lens is about 15, and the length of most eyeballs would be about 16 millimeters. Now, if your dioptric value of your cornea is different and your eyeball is different, it could be that you still have zero prescription. When the light comes into the eye, it then would focus in a perfect system through the cornea, through the lens, and would focus perfectly upon the retina. If the eye is not right, then things will be blurry. For instance, if either the power of the eyeball is weaker or stronger, then that could cause the light to bend in front of the retina, or if it's weaker, it could cause the light to bend behind the retina. If the eyeball is too strong or too long, then this type of situation would happen. And if the eye power is too strong, then a minus-powered lens will take some of that power away. And that would be somebody who is called a myope. If the eye power is too weak or the eye is too short, then that person needs a plus-powered lens to bring that light into focus. Someone that has too much power is said to have myopia, and they need a minus-powered lens. Someone that has too little power is said to have hyperopia, and they need a plus-powered lens for their system to be right. Nearsightedness, or myopia, is when a patient can see in the distance, but can't see in the distance, but their up close is okay. The eyeball is either too long or their eye power is too strong. Light enters the light and it falls in front of the cornea, causing a blurry image. If we then take a minus-powered lens, that will diffract some of that light back to the retina to make it clear. They have distance, and the distance is blurry, eye strain, headache, squinting, and they need to move closer to objects. Hyperopia, or farsightedness, means the patient can see in the distance. Their eyeball is too short or their cornea is too weak. light enters and then the light falls behind the cornea, and this can cause blurry vision at near. Now, in the reality, if a patient has enough hyperopia, their distance vision will also be affected because if it's too much. But if it's just a little bit, they may be able to compensate through it. Hard time keeping near objects clear, difficulty concentrating, hard time switching between near and far objects. They may have brow aches or headaches, and the eyes can get fatigued easily. So for myopia, the exact cause is unknown, but usually it's genetic. It's more prevalent in Asian populations. It can be problemsome if school-age children and teenagers. It may be as a result of the kids not getting enough sunlight, doing lots of close work without giving their eyes a break, and it can be more prevalent in premature babies. Patients with dense cataracts tend to be more myopic. Hyperopes, it can get worse with age, and there's a reason for that. Genetics, Caucasians tend to have it more, and diabetic patients.